Good afternoon, everyone, and welcome to our Back to Basics webinar series. For those of you that have joined us before, it's great to see you again. And if this is your very first session with us, we are also glad to have you here. I'm Andrea Boucher. I am a Quality Improvement Advisor at Superior Health Quality Alliance, and I will be your facilitator for today's session. And the topic that we are going to cover for today is health literacy and chronic disease management, presented by Mia Croyle. The slides for today's session are going to be shared in chat and are also available on the Superior Health Connect site. We do ask that you please use the chat box to submit any questions or comments throughout the session, and we will have some time for verbal questions and answers at the end of the session. And for our future topics, as I mentioned, today's session is part of a webinar series. Our webinars are on the third Tuesday of each month. Our next session is going to be focused on sustainability and is scheduled for October 15th. And without further ado, I am going to turn it over to Mia.
Thank you. And hello, everybody. Thank you for joining us for a little lunchtime learning. I am with Superior Health. In that capacity, I work on several different areas of our work. Most relevant to the content that we'll be talking about today, I'm on the health equity, health literacy, and culturally and linguistically appropriate services work groups. So our objectives for today, hopefully after this talk, you will feel a little more equipped to describe the role of communication in informed patient engagement, define plain language and what are some of the key elements that make up plain language or that we should look for in evaluating plain language, and then to use some techniques and practical strategies to draft plain language documents. So when we think about the role of communication, health literacy is often brought up as a important consideration. So there are two sort of levels of health literacy. There's personal health literacy, and that's how well an individual can find, understand, and use the information and services that we're offering to make health-related decisions. And then the organizational health literacy really looks at, on an organizational level, how well are we doing at enabling people to find, understand, and use our information and services. So it's sort of like looking at two different lenses of the same thing. We're primarily going to focus and think about personal health literacy, but we're going to look at it from an organizational level. So how can we make sure that the information and services we're providing are easy to find, easy to understand, and easy to use for individuals? And why is this important? Why do we have to attend to this? We know that more than 4 out of every 10 adults struggle to understand health content that's written for the public. So general health information that is shared is not accessible to all of our people. If you were in a room with 100 people and 40 of them would not understand the basic general health messages that we're writing and sharing for the general public. We also know that low health literacy, so not being able to easily access, find, use, and understand that information, has been linked to poor health in general. It's also been linked to increased hospital admissions, low vaccine uptake, and reduced life expectancy. So you want to do something to help extend the life expectancy of the patients that you serve. One way we can work on that is by making sure that we've designed our written materials and that we're speaking to patients in a way that is accessible even for those with low health literacy. We know that groups that tend to be at the highest risk for low health literacy include communities with language barriers. So immigrant communities that speak a different language, etc. Also, people with learning disabilities and people living with dementia also struggle to understand that health content. And what does this have to do with chronic disease management? So we know that health literacy plays a crucial role in chronic disease management. In order to effectively, comprehensively manage any chronic health condition, just on a daily basis, people must be able to assess, understand, evaluate, and use health information. That may look like things like reading your prescription label and understanding what the directions are and understanding what you're supposed to do based on the directions. Understand the claims that are made in an ad. You know, we all see so many ads for prescriptions, and, you know, being able to see that ad and make sense of that and have some basic understanding of what the ad is promising and not promising to be able to do. It also might look like assessing the claims that are made for a new product, diet, or supplement. You know, do this fasting diet to cure your diabetes. Well, if you're not understanding and assessing those claims and able to navigate, is that a good idea for me? Is that maybe not a good idea for me? Is that something I should talk to my physician about? All of those things. Also, you know, navigating our healthcare system to make appointments. If I am managing a chronic condition, there's a high likelihood that I need to schedule some appointments with someone in a specialty of some sort. And being able to navigate that system, navigate my insurance, and know where I can go and what I need to do to schedule an appointment, maybe what I need to do to prepare for an appointment. All of that requires health literacy. We also, you know, might have to trust that someone can read and respond appropriately to messages that we send them on a patient portal. And also, you know, that they may be able to understand and accurately answer questions on a health questionnaire. And there are many more activities that someone working to manage a chronic condition has to do that involve aspects of health literacy. So, who is responsible for health literacy? Some people will say that it's the patient's responsibility. If they can't decipher the material, they should either speak up and let someone know that they can't decipher the material or that they don't understand, or they should find another resource to help them with that. Often that burden of accommodating a person's lower health literacy might fall to the family. So this is often true in families with limited English proficiency. If there's one English speaker in the family, that person becomes sort of the de facto manager of everybody's health and healthcare appointments and healthcare needs. When we think about who should be preparing people in our country to make sense of health messages, often we think, well, why aren't the schools doing a better job of this? There are also community organizations that have taken on some responsibility for health and health literacy. And we know that healthcare providers and their teams can be held responsible for health literacy. That's part of the culturally and linguistically appropriate services. And, organizations, healthcare organizations, and healthcare providers and their teams are, held accountable to those standards. And then public health organizations. So in reality, what it looks like ultimately is often a collaboration between multiple people on this list. And one of the things that has been proposed multiple times, so this is certainly not new from me, is this idea of health literacy as treating it as a universal precaution. So rather than thinking about, can I use one of the tools that's out there to help me assess for health literacy needs? Thinking, I'm going to assume that all of my patients might have lower health literacy. And then as I'm in conversation with them, if they're demonstrating to me a higher level of understanding, then maybe I can switch it up a little and not use some of these plain language practices as much. Give them more technical information if they're asking for it. But as a universal precaution, as a sort of baseline assumption, we should assume that lower health literacy is more the norm. So I've mentioned plain language a couple times. Let's get a definition. So plain language is defined as communication that your audience can understand the first time they read it or hear it. Now, sometimes that's a big task, particularly in a healthcare appointment. Sometimes those appointments are a little emotionally charged. Someone might be already feeling very vulnerable and overwhelmed. And that doesn't, when we think about our brain science, that doesn't put us in the brain space of logical understanding in our strongest way. So sometimes people might need repetition, multiple, or to see or be exposed to the information multiple times, just because they weren't in a space to hear it, not because it wasn't in plain language. But generally, we want to strive for information that somebody doesn't have to sit down and study. Somebody doesn't have to sit and take it apart and try and make sense of it, decipher it. This should be information that's readily accessible and can be accessed the first time someone reads it or hears it. Plain language enables the person receiving the communication to find what they need, to understand what they find, and to use what they need, use what they found that they needed to meet their needs. So really, if we think about this, it's, am I able to find it? Am I able to understand it? Am I able to use it? This is the sort of mantra over and over again for looking at, designing materials for lower health literacy. Can I find it easily? Can I understand it easily? And can I use it easily? So some of the key elements or main elements of plain language are, first and foremost, organization. The information is organized in a way that makes logical sense, in a way that flows, and would make sense to a naive reader. And I mean naive just as someone who hasn't encountered that information previously. Generally, plain language, we talk about using active voice. So that's where we have a subject doing a verb as opposed to some vague thing verbing. And we'll look at that example as we go on. And then plain language also uses common everyday words. It may not be medical jargon, but sometimes we use words that aren't everyday language in stringing together our jargon or not jargon. And that can be confusing for people as well. Generally, plain language has short sentences and short paragraphs. Plain language uses you and other pronouns, but it generally speaks directly to the reader. And then it has easy to read design features. We could do a whole nother presentation on design for low health literacy, but this topic is really just about designing your content. But if you have a great graphic designer that's accessible to you, or someone in your communications department who can help you with the layout and the design of your documents, that makes it even more powerful. Generally, we want a lot of white space, and we want to be able to use bold, heading, things like that to break up the content. So what are some myths about plain language? We know that plain language isn't just baby talk. It's not an attempt to be sort of cutesy, folksy, that kind of thing. It isn't removing necessary technical or legal information, right? So sometimes someone needs to know what the technical term for something is. And there are ways that we can share that with them. It doesn't mean we can't ever use the technical term. We just have to make sure that they're understanding the technical term before we just are off and running with it. Another very common myth about plain language is that it's imprecise, right? So I'm using this highly technical language because it's the most precise way to share the information. Plain language can be just as precise, but it doesn't have to have as much jargon. This next one is more about the process, right? So it's hardest to create plain language if you finish all your writing and then think you're going to go back and polish it up a little bit, clean up those sentences, maybe insert a word here or there. That can be done, and that is one way to get to a plainer language document, but that's not the best way. Process-wise, the best way is to design a document from the beginning with plain language elements in mind. Plain language is not just using pronouns and then maybe doing an FAQ or Q&A format. Although those elements are both often included in plain language. And then the last one is that plain language is not always easy to do. In fact, it's rarely easy to do. It takes a lot of intentionality. As healthcare providers, we tend to think in this jargon and this highly technical language. And so for us, it's a matter of translating that into plain language so that we can use it effectively with our patients, as opposed to offering our patients that highly jargony, technical language and asking them to do the deciphering. So we're taking that burden on ourselves to decipher it sort of translate it into plain language. So I want to share with you some practical strategies for drafting plain language materials. And this is, these are specifically for written materials, but what I will say is that speaking in plain language is just as important. And a lot of these strategies apply as well. It's just harder, honestly, to speak in plain language because you're doing it in the moment. So you don't have a chance to write it down and then go back and revise it and edit it and, think real hard and maybe use a thesaurus for a synonym for a word that seems like it's not a common word, those kinds of things. So when we think about drafting plain language materials, often I think this step comes first. I can tell you when I first started out sort of on my journey of wanting to use more plain language, I worked on a lot of written documents, and then I would memorize some of the phrases that were used in the written documents to incorporate into my spoken language. So the first thing, if we're starting from scratch in creating a plain language document, we want to identify who's the audience and what is the best way to organize this information to meet their needs. So why does this person need this information? That's one thing I often press people about, because in healthcare, we are a very information heavy industry. And as healthcare professionals, we know a lot of information. We had to learn a lot of information in our professional preparation. We use it on a day-to-day basis. We're just very information heavy. Generally, the patients we serve are not coming from information heavy worlds where they're used to that. So we really have to be thoughtful and conscientious about only sharing the information that really is a need to know. And we have to parse out, what is it that I want to say and what is it that I know they need to know? Because often we want someone to know something because we feel like it's important that they know it. I worked with a group that was working on communication around diabetes, particularly with some Mexican immigrants. And they had done a lot of the translation so that, they had their materials in Spanish. But those materials were so information heavy. And what they were learning was that just because their patients spoke Spanish didn't mean they read Spanish, and didn't mean they had a high level of health literacy in Spanish. So one of the points of sort of contention was that these diabetes, and this was a group of diabetes care managers, and they really felt very strongly that these patients needed to understand what caused diabetes and what was happening in the body. And their main goal in working with these people was to get their blood sugars under control. Okay? So I kept asking them, why do they need to know how they got diabetes? Well, and one of the things that sort of really bothered these diabetes care managers is that there was sort of a belief in the community that you could, quote unquote, catch diabetes from going in and out of the cold weather, like without, having enough of a coat on or something. And they really wanted to disavow their patients of this belief. And they were getting into power struggles with them over this, which is a whole nother issue. But they also were sort of spending a lot of their information giving time focused on that. And I don't disagree that ultimately having a good understanding of that would be a good thing. But when you have a patient who doesn't understand what to eat to better manage their diabetes, when you have a patient who doesn't understand how to take their medications, or the impact that exercise can have on blood sugar levels, it seems to me we might want to think about what is the most need to know information for those individuals and start there. We also, when we're conceptualizing what the recipient, needs and how are we going to organize this information, who's our audience, we can think about what is the average recipient's level of healthcare knowledge. Can we rest assured that they have some basic understanding of how the body works, or are we working back on basic biology here? We want to anticipate questions that they might have. And then we work to organize our information to answer questions in the order that someone might logically come up with that question, so that they don't have to wonder for too long, because that takes up mental space, that takes up some real estate in your brain if you have a question that goes unanswered. So how can we organize the information in a way that as a question might come up, we're providing the answer? So now we're going to look at some specific tools or techniques that we can build into creating more plain language documents. So the first one is a wise use of headings. So headings are good because they allow the person reading to navigate that written material at sort of a quick level. They can skim the headings and find where they need to be on the page. It also breaks up the information. So if you have multiple, if you just have a page with 6 paragraphs on it and no headings, that's, a little more overwhelming and hard to find what you need easily than if there are headings over some of those sections. It also increases the blank space on the page, which is one goal you're trying to do. Remember, I said with the layout and the design of your plain language documents. And then, using questions as those headings can help the individual relate to the information that's being shared. So we're not just, saying a standard heading, as we talked about on the last slide. We're anticipating what their questions will be, putting that question as a header, and then answering it immediately below. Another guideline is for plain language is to always aim to keep it short. So smaller bites of information are easier to digest. We want to offer fewer ideas, fewer paragraphs. We want those paragraphs to be shorter. So less than 7 lines. And then thinking about only one subject per sentence. So we don't want to have these long run-on sentences that combine 2 ideas, those kinds of things. We really want to stick to simple sentence structure and one subject per sentence. We want to try and keep our sentences less than 20 words. So fewer words in general and shorter words, right? So less is definitely more with plain language documents. And then I mentioned this already, but the use of pronouns, it speaks directly to the reader, draws them in. It can also eliminate words and eliminate large words. So instead of saying patients with diabetes, we might say you, if it's a handout that's going to be given to someone with diabetes, right? So that makes it easier to read. It makes it more accessible. It requires less work for their brains to grasp the meaning, and it eliminates those unnecessary words. So here's our example. The patient should schedule regular visits. You should schedule regular visits. And we want to use an active voice as opposed to the passive voice. So with our active voice, we're speaking in a way that's clear and direct. We make it clear who does what. It's much more concise, so it helps us with our previous tenet of, keep it short. And active voice is often much more of a natural flow to the sentences. And then I already spoke a little bit about this. We want to, when possible, avoid jargon. When you have to use a word, a technical term, or something that could be considered sort of medical jargon, we want to also offer a plain language definition of what that word means. We want to think about using language that's familiar to your audience. And if you have to use acronyms, define them, and if possible, just avoid them altogether. And then we want to just use common, plain, everyday language. So this little table shows or demonstrates, right? Shows some examples of that. So instead of saying attempt, we can say try. Instead of saying demonstrate, we can say show. Instead of submit, we can say send. Terminate, end, or stop. In the event that can easily be if, right? So I will say I find it hard to write this way. It's an intentional practice. I tend to, want to write at a college level. And you use those big fancy words, college level words, when you're writing in that way. That's my inclination. But with intention, I can write in this plain language way. And that's what oftentimes it can take to make that shift. Just some intentionality. So we're going to practice with a couple samples here. And so I invite you to either take yourself off mute and just verbally participate, or you can type in the chat as we go. So I'm going to put up a sample of, before I do that, I'm going to tell you a story, but after my story, I'm going to put up a sample of some clinician speak. And I want you first to look through that and identify where are the problem areas if we were evaluating this in terms of how well they did with plain language. Where's the problem spots? So first I want to tell you a story. This is a lovely picture of me I think I was 12 at the time. And I went on a ski trip with my middle school friends, and it was a school-sponsored ski trip, so we all took the bus. And middle school and high schoolers went together. Very exciting. The first time I was able to go, first ski of the season, first time I was able to go on these fancy, ski trips. My older brother had been going on them for years. So I had watched him, happily go off onto these ski trips. And now I was all grown up and going myself. First run down the hill, hit a patch of ice, and skied directly into a tree. The ski patrol came and brought me down to the bottom of the hill. Someone found my brother. The ambulance came and took me to the hospital. In the ambulance, I heard them calling and giving report. They let my brother ride in the back with me. And this was my brother's finest, most brotherly hour. He was holding my hand and it's okay. Mom and dad won't be mad. All those big brother things that, a teenager barely knows to do. But we heard them calling in to the ER on their way, the ambulance, and they said that I had multiple lacerations and contusions. And I looked at my brother and he looked at me and I said, "What are those?" I whispered. And he whispered back, "I don't know, but it sounds bad." So, come to find out, it meant that I had bumps and bruises and cuts, which is what I had, as you can see in this lovely picture. But, that's a perfect example of, plain language versus our medical jargon, and how disorienting that medical jargon can be to a patient or someone who isn't familiar with those terms. All right, so we are going to find the problem in this little bit of information sharing that may be in a flyer or a handout. It may be something someone's clinician says to a patient. So I want you to put in the chat or just come off mute and say what areas seem problematic here. Hypertension or high blood pressure is when the systolic and the diastolic pressures exceed the normative values, leading to increased vascular resistance and potential end organ damage. I'll give everybody a minute to just think about, where are you seeing a problem there? If there are too much jargon, if there are particular words that seem problematic, feel free to put them in the chat. Phrases that you think they could have said better.
Yeah, Mia, we have a couple comments in chat. Too much jargon leading to fear. Too much jargon without plain language definition. Systolic, diastolic, vascular resistance, and organ damage are problematic.
Yeah. Those are like those scary, it could have used a simpler word for normative, right? Oh, and they don't state what normative values or high pressure values are. Needs to be simplified with what that all means with systolic and diastolic and leading to vascular resistance. Yeah. All right, so let's see here. I don't know why my slide won't advance. Here we go. All right, so yeah, this is kind of what we worked up to. So his systolic and diastolic pressures exceed. That's a fancy word, right? When a simple one could do normative values, leading to increased vascular resistance and potential end organ damage. So that sentence is long, right? We set our target for sentences as 20 words or less. This is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 25 or 26 words in there. So it's a little bit too long. It's not too terrible. There are definitely some jargon or technical words, the end organ damage, vascular resistance, systolic, diastolic pressures, right? And then even when it wasn't a technical term, we're using less common language. So exceed, normative values, potential, right? They started off so well with hypertension or high blood pressure, right? That's what we want to do when we introduce a technical term like hypertension. We want to define it as high blood pressure. So I'm going to give you a chance to rework this in a plain language way. So just put it in the chat. How would you say this in a plain language? You could do part of it. You don't have to do the whole statement if you don't want to. Okay, so we've got a couple in the chat. I'm guessing maybe people are still writing. But one is your blood pressure was higher than we like to see it. If it stays high, it can lead to worsening issues. Nice. I like the your, right? Using the pronouns, just like we said. When the top number and the lower number are too high. Oh, 1, 2. So I'm not sure about the beginning, but you were typing pretty fast. So the top number and the lower number are too high. Normal would be 120/40. We need to keep it down to avoid further issues. Yes. Nice. If you're still working on it, you can still put it in the chat if you want. This is what we had come up with. High blood pressure means that your heart is working harder than it should to pump blood through your body. Over time, this can cause problems like heart disease or stroke. Right? All right, got another one in the chat. Hypertension, high blood pressure is above the normal range of 120/80, and that can cause worsening issues and can cause damage to your heart or kidneys. Yes. Nice. All right, sticking with our hypertension, we're going to take a look at another problem. This one's a little longer. Hypertension can be primary or secondary. Primary hypertension, also known as essential hypertension, has no identifiable cause and is multifactorial, involving genetic predisposition and environmental factors. Secondary hypertension results from an identifiable cause, such as renal artery stenosis, hyperaldosteronism, I can't even say those two words, and two highly technical words I can't say. We crammed a lot in there for you to find. So what seems especially problematic for you? Put that in the chat. You don't have to list all of the things, but what sticks out as glaringly problematic for you? Yeah, the general public will not understand this primary and secondary along with other diagnosis. So that part should definitely be simplified. Explaining in plain language, genetic predisposition and environmental factors, give examples of that. Absolutely. All right, in the interest of time, I'm going to keep us moving along. So let's see what we, all right, so I highlighted some of the especially problematic ones, right? Primary or secondary, essential hypertension, identifiable. And then, you know, some of the things that weren't like diagnosis, but multifactorial. Like, what the heck? That's not plain language. Yeah, too long, lots of jargon and technical language, lots of places that we use less common language, and the passive voice, right? So this is a great example. Hypertension can be primary or secondary, right? This whole thing is in passive voice. So how do we fix it? Anybody want to take a stab at a fix, at least for one portion of it? This paragraph is overwhelming, needs to be parsed down considerably for anyone to grasp the meaning. Absolutely. It's a lot. There's a lot of content in here. All right, so let's see what we came up with. Okay, there are a few things that can cause high blood pressure. It can run in families, so if your parents had it, you might too. Other factors include eating too much salt, not getting enough exercise, being overweight, and stress. And sometimes it just happens without a clear reason. All right, we're gonna do one more. This one is about find the problem. Management involves both pharmacological and non-pharmacological interventions. Non-pharmacological measures include dietary modifications, such as adherence to the DASH diet, which emphasizes consumption of fruits, vegetables, and low-fat dairy products, while reducing sodium intake. Pharmacological treatments may involve the use of antihypertensive agents like ACE inhibitors, ARBs, beta blockers, calcium channel blockers, or diuretics, depending on the patient's comorbid conditions and overall cardiovascular risk profile. Whew. All right, just in the, you thought that last one was overwhelming. This one's overwhelming to me. So yeah, we've got acronyms without saying what they stand for. We've got longer sentences than our goal. We've got a longer paragraph than our goal. We've got a ton of like, why would you say non-pharmacological or pharmacological if you could just say medication? Like that's something people are going to understand better. Yeah, just a lot with this. So let's see how it, went too far. So here's one way that we could offer similar information in a much more low literacy type of way. We have information and resources for you about how you can make some minor lifestyle changes, such as changing your diet a bit and becoming more active. I don't want to overwhelm you, so let's start with some small changes, right? So, and then you want to just respond to what questions they have if you're in conversation. If this was a written document, you might have a short list of possible first steps, right? And then if the person asks about medication, we can say sometimes making lifestyle changes isn't enough on their own. Medications can help. There are different types of blood pressure medications, and if you need one, we'll find the one that works best for you. All right, well, thank you for playing along in our sort of Mr. Fix-It game. I did just want to share that in the resources that will be sent after the call or available to you, there are a variety of different health literacy resources. Some of them I'll call out in particular, the Wisconsin Health Literacy Program has a program within there that worked on medication labels. So if you're looking for information about how to make medication labels more plain language. And then here we have a glossary for clear language, and lots of different tools and resources. So at this point, we can open the floor if there are any questions. Carrie put the link to the presentation right in the chat, so you can grab it from there. Thanks, Lori. All right, so I think there's a couple little last housekeeping things.
Yeah, thanks so much for your presentation, Mia. I think that these are really great examples in how to really start using that plain language in practice. So as Mia mentioned, the link is in the chat for both the presentation slides and our evaluation. So we would love to hear your feedback on what you thought about today's session. We are also going to launch some polling questions, so we will get those queued up for you in just a second. But just some quick questions on if you found the information in this session useful and how satisfied you were with today's session. So get those polling questions queued up for you real quick. And then we'll get the second question pulled up for you. And Mia, you can advance a couple slides. So as we're waiting for some responses on those polling questions, I'll just go over some of the last minute housekeeping items. Just go to the next slide. As a reminder, our next session is on October 15th. We will be covering sustainability, so we hope that you're able to join us for that session. Next slide, please. We are also launching our Tobacco Cessation on Demand learning series. This is really helpful. We're calling them our Quitting Quick in our series, guiding the path to becoming smoke-free. Some bite-sized learning modules to help work with individuals on their journey to becoming smoke-free. So we do have a couple of different topic areas that are covered in those lessons, and there's some knowledge checks at the end. So we encourage you to check those out once we do have those launched. And just a couple more reminders, since you're here, I'm sure you're registered for the series, but for registering for the October webinar, sign up for Superior Health Connect. We have a lot of great resources and conversations going on in Superior Health Connect there. And if you are interested in any one-on-one assistance, if you are in need of any help or have any questions, you can feel free to reach out to Jerry Hineker. If you go to the next slide, Mia, Jerry's email is on this slide, or you can email anyone on the Superior Health team, and we will get you some help. Next slide, please. I mentioned Superior Health Connect. So the link to get into that platform is on this slide, which we shared the slides in chat. But we encourage you to connect with us on there. Like I said, a lot of great resources and conversations around the topics that we've talked about today, and others related to chronic disease management. So we encourage you to get on there and check it out. And go to the next slide, please. One last reminder, our Frontline Forces training modules are available for you to access at the link on the slide or through the QR code. We cover a lot of different topic areas, including pressure injury, fall prevention, UTIs, vaccinations, lots of different topic areas. So if you're interested in checking those learning modules out, the link is available on this slide. Next slide, please. And that's all we have for you today. Thank you so much for joining us today. And we hope that we see you again in October. Thanks, everybody.